Dr. Alex Summers. A welcome to the members of the media who are in attendance this afternoon as well. We hope that you have some questions to pass along, and if you do, and you're new to Microsoft Teams, just click on the text bubble with the question mark in it. If you could indicate your name as well as your media outlet and who your question is for. And finally, a welcome this afternoon to folks who are joining us on Rogers Television, as well as the Rogers Facebook page and YouTube channel, listeners on Global News Radio 980 CFPL, and those who are tuning in this afternoon on the CTV London website. Let's get to the opening remarks, and we'll start this afternoon with Mayor Ed Holder. Mayor Holder.
Well, thanks, Dan, and good afternoon, everyone. While we await an official announcement, there are multiple reports that Health Canada is going to approve the Pfizer COVID-19 vaccine tomorrow for kids aged 5 to 11. This has the potential to be an absolute game changer, especially here in London, Middlesex, where this age group has the most active cases per capita. Look, being able to get shots in arms just as winter weather takes hold is crucial. And it appears, based on these reports, we'll be doing just that in the near future. As I've said before, I'm expecting significant uptake from that 5 to 11-year-old age group, especially because our 12 to 17-year-olds have among the highest first dose vax rates anywhere in all of Ontario, just under 94%. Meanwhile, where overall vaccination numbers are concerned, while we are doing exceptionally well at almost 90% with at least one dose, you know what that means? It means that still 1 in 10 who are eligible, but have yet to receive a single shot. And 1 in 10 is not an insignificant number. In fact, based on how many people you know, I'm sure we all have someone that we know who is unvaccinated, maybe several. But the reasons to get the shot are obvious, and those who have held off this long are well aware of those reasons. So I don't need to, and nor do I wish to repeat them all. However, consider this. The holiday season is fast approaching. Vaccination status inevitably creates divides and frustration within families and extended families. That's vaxxed versus unvaxxed. I understand those who are vaccinated not wanting to risk exposure from family members who are unvaccinated. So, to those who continue to refuse the shot, at least consider that. We have a chance at our first normal or semi-normal Christmas or Hanukkah or Kwanzaa in almost 2 years. Let's not ruin it by stressing them out and putting vaccinated family members in a difficult spot. And you, for that matter. Just get the shot and then get together like old times. We know it's safe, we know it works, we know it dramatically reduces the likelihood of severe illness. We also know it will dramatically reduce the risk of stress and confrontation in the lead up to whichever holiday you and your family celebrate. Don't let the vax, anti-vax situation be the family deal breaker. It's not worth it for the sake of family, and it's not worth it for each other. Again, I know that my comments likely won't change anyone's mind at this point, but you know, it's something we all have to try, and it's something I wanted to highlight, and perhaps something else to consider, especially as we approach the holiday season. So with that, I'm going to turn it over to Dr. Summers for more wisdom. Thanks.
Thank you, Mr. Mayor, and good afternoon to all joining us today. As the Mayor noted, we are anticipating, through a number of reports, announcements from Health Canada around the approval of a vaccine for 5 to 11-year-olds, and work is well underway here at MLHU as we prepare for that approval. All indications suggest that in a short while, pediatric vaccine will be arriving in our region. We'll be sharing more information in the near future as we get updates from the federal and provincial government, but here's what we expect. Once the vaccine is approved by Health Canada for those under the ages of 12, guidance on the use of the vaccine will be provided by the National Advisory Committee on Immunization, and the vaccine will start to be sent to the provinces. The Pfizer vaccine for kids under 12 comes in a different vial than the previous Pfizer vaccine, so we can't just use the adult vials we already have. We have to wait for the arrival of those pediatric or child vaccines. Once the vaccines are received by the province, they'll be distributed out to the health units as well as pharmacies. The timing of the arrival of the vaccines will dictate when we can start vaccinating kids under 12, but it's going to happen very quickly. In Middlesex-London, kids 5 to 11 years of age will be able to get vaccinated at MLHU's mass vaccination clinics, participating pharmacies, and through participating primary care practices. The mass vaccination clinics have been preparing for weeks, in order to make our mass vaccination clinics as child and family friendly as possible. For you kids out there, you'll soon start to be seeing more of our vaccine superhero, and you're about to see that vaccine superhero on your screens. Our vaccine superhero is keen to have you join with them in fighting the COVID-19 pandemic here in London and Middlesex County as soon as you have the opportunity. We're really looking forward to you getting to meet our vaccine superhero and for you to join the ranks of all the vaccine superheroes who've gotten vaccinated to date in the Middlesex and London region. Once we have a better sense of when the vaccine will be arriving, MLHU will announce that people can begin to book appointments at our mass vaccination clinics by either visiting that familiar website, www.covidvaccinelm.ca, or by booking through the phone line. And again, more information on that will become readily and rapidly available once we get further insight from the federal and provincial governments. While we're waiting for that announcement and for the arrival of vaccine for kids 5 to 11, booster doses are available to the following eligible groups 6 months after they receive their second dose. Those groups include anyone over the age of 70, First Nation, Inuit, and Métis people and their non-Indigenous household members, and that's for adults 16 years of age and older, healthcare workers and essential caregivers who work directly with patients, and individuals who received a full series of a viral vector vaccine like 2 doses of AstraZeneca or 1 dose of Johnson & Johnson. Thanks so much to everyone who's gotten the vaccine to date. 89.7% of everyone over the age of 12 in our region has received at least 1 dose. We're nearly at 90%, and that's a remarkable accomplishment. Everyone in this community has shown time and time again that they are willing to play their part in ending this pandemic. Thank you so much for doing that. The vaccine has been critical to keeping our case numbers low this fall. However, case counts are rising across the province and have also climbed ever so slightly here in the Middlesex-London region in the last week. Today, we are reporting 13 new cases, bringing our active case count to 115 people. The incident rate is still much higher amongst those that are unvaccinated. We need to stay vigilant and continue to take those simple steps to reduce the risk of transmission as much as possible. If you are gathering with people outside your household, make sure that everyone is vaccinated and keep it outdoors as much as possible. The holiday season is approaching, and we want that holiday season to be as joyous as possible. So make sure that everyone around you is getting vaccinated. It's going to still be important to keep those gatherings smaller than you might have done in previous years, and make sure, again, that everybody is vaccinated if they're eligible. We'll be providing additional guidance soon because we do know that plans are well in place and well on their way for the holiday season. I also want to remind everyone that proof of vaccination is now and remains required to access certain public settings, including indoor areas of food and drink establishments that do not have dance facilities, as well as indoor and outdoor areas of food and drink establishments that have dance facilities. Indoor areas of meeting and event spaces, indoor areas of concert venues, theaters and cinemas, and of course, sports and recreational facilities as well. For owners and operators of these facilities, it is critical that you are requiring proof of vaccination from all patrons who are eligible to receive the vaccine before they enter these types of facilities. I also want to remind owners and operators that there are still capacity limits in place for some settings. Food and drink establishments that permit patrons to dance are still required to limit capacity to 25% of the occupancy load up to a maximum of 250 patrons. And tables must be arranged in order that patrons must be seated at different tables separated by 2 meters or a physical barrier. Strip clubs are also limited in the number of patrons who can maintain physical distancing, and tables must also be arranged in order that patrons must be seated at different tables separated by 2 meters or a physical barrier. We are well on our way out of this pandemic. However, the last number of weeks are reminding us, as we see caseloads rise across the province, that we're still in the thick of it. Get yourself vaccinated, get your loved ones vaccinated, continue to wear your mask indoors and keep those gatherings outdoors when you can. and we will still get through this. Thanks as always for joining us, and I'll pass things back to Mr. Flaherty. We're happy to take some questions.
Thank you very much, Dr. Summers, and do appreciate that very much. We do have several questions in the queue. We'll get to those in just a moment as I switch screens and bring those up so I can see them. All right, here we go. Let's go with our first questions from Jane Sims at the London Free Press. Dr. Summers, how quickly will the vaccine rollout for kids begin here once the anticipated announcement is made on Friday? And again, just to be clear, the expected announcement tomorrow is from Health Canada on approval of the vaccine. Will the Agriplex and Mount Bridges be used exclusively for vaccinating children for the next couple of weeks?
Thanks for that question, Jane. We will be going as quickly as we can to open up vaccination to kids. The major rate limiting step will be the arrival of vaccine in the Middlesex-London region. And making sure that we still have appointment space. Obviously, we've been booking appointments for booster doses. However, we've been holding appointments back in anticipation that kids under the age of 12 would be approved imminently. So there will be appointments available pretty much at the drop of a hat once we have the vaccine available on site. We're still waiting on the details of exactly how quickly that vaccine is going to make its way down to our region. The Agriplex and Mount Bridges Caradoc Community Center will be used primarily for pediatric vaccination. We're having separate appointment spots set aside. Our priority is getting first and second doses into 5 to 11-year-olds. So it's going to be about 70 to 75% of appointments will be reserved for pediatric appointments, the remainder for those booster doses. As we get further on into the holiday season, we'll actually look at using some weekends and some weeks right after school is over to really focus on pediatric vaccines. We'll have a bit of a blitz week and more to come on that.
Suffice it to say, lots of plans developing and already in place as soon as the announcements and the guidance are received from both the federal and provincial government. Follow-up question for you, Dr. Summers, from Jane Sims at the Free Press. Dr. Summers, based on recent science table modeling that is pointing to a large spike in cases in the coming weeks, there appears to be pressure mounting on getting booster shots out to everyone. Will we have the capacity for boosters if Health Canada orders them sooner rather than later?
Great question, Jane. Certainly, we know that even of the people that are currently eligible, many will be hitting that 6-month mark through December and January. We've been planning our mass vaccination capacity in order to meet the demand that may arise from those groups being eligible. I also want to highlight, though, that pharmacies and primary care will also be a significant contributor to providing booster doses to those that are eligible. So we are ramping up operations at the Agriplex, and we'll be ramping up operations at Caradoc Community Center later on in December. We'll also be exploring expanding to some additional sites. We'll also be on some non-mass vax clinic sites through December. We're just finalizing the details on that. We had some great success in delivering vaccine in some of our local malls, and we're hoping to get back into those malls. More details to come once we finalize that. So again, we are ramping up capacity as much as we can in anticipation of both 5 to 11-year-olds and booster doses rolling out. One thing I want to highlight is that we anticipate that the interval between first and second doses for 5 to 11-year-olds, as well as for anybody receiving their first dose of any age right now, is likely going to be extended out to 56 days or 8 weeks. The guidance from the National Advisory Committee on Immunization has emphasized that that extended second dose interval is actually of benefit. And so for the pediatric population, we'll hear from NACI shortly, but we anticipate that the second dose will actually be at the 56-day mark rather than the 28-day mark. So we're also planning our capacity around that extended dose interval. Lots of moving parts, lots of unknowns in all of this, but at the end of the day, we hope that we will have lots of capacity between mass vaccination, mobile clinics in the future, pharmacies, and of course, primary care as well.
Thank you for that comprehensive answer, Dr. Summers. Let's go on to our next question. It comes from Jennifer Beeman at the London Free Press. Dr. Summers, the COVID-19 situation in southwestern public health is not the greatest. How much of a threat to Middlesex-London are case spikes in neighboring regions?
Thanks for that question, Jen. certainly as we see case counts rise across the province, they cause concern for a couple of reasons. Certainly, the closer they are to us, where we see those rising cases, the greater the risk of transmission. There's no borders here in Ontario, as we know. We go from county to county fairly readily. And so therefore, if we see transmission in our neighboring jurisdictions, there is certainly an increased potential for transmission in our regions as well. The nature of the transmission that's happening in Southwestern Public Health seems to be primarily amongst pockets of unvaccinated individuals. We know even here in Middlesex-London, that's where transmission can readily happen. The key thing, again, is what can we do here in Middlesex-London? And that's what we've been doing to date. Getting vaccinated, wearing your mask, keeping your distance, keeping it outdoors, those things still count. Obviously, we're watching very closely what's happening in our neighboring jurisdictions. There are certainly signals here in our jurisdiction that case counts are climbing slightly, or at least not going down the way they were in the last number of weeks. All of this is something we need to pay critical attention to. The key thing is we still need to emphasize vaccination and masking. Hopefully, we can get 5 to 11-year-olds vaccinated readily so that that takes a large chunk of our unvaccinated population and make sure that they're not vaccinated and gets them vaccinated, pardon me. But in the meantime, if you're eligible, get vaccinated. It's the most important thing we can do.
Thank you very much, Dr. Summers. There's a follow-up question here from Jen Beeman about that. Is Middlesex-London able or willing to provide support to Southwestern Public Health should there be a need to provide that assistance?
Thanks, Jen. Certainly Middlesex-London Health Unit has provided case and contact management support to other health units in the province before when the need arises, and we have capacity locally. And certainly we would be able to do the same for our close neighboring jurisdictions. At this point in time, we are not, and again, have not been asked to do so, but we are certainly willing if we have capacity. Obviously, we're watching our own numbers here closely. We have to be able to respond to outbreaks and cases in our region, which we're able to do at the moment, but we are not currently providing support in that way to Southwestern Public Health.
Let's go to our next question, and it comes to us from Craig Needles at Blackburn News. Dr. Summers, do you expect that all school children born in 2017, even the ones yet to turn 5, will be permitted to receive the vaccine early next year? And of course, this is similar to the situation we saw with children who were turning 12 in 2021. So have we heard anything similar about kids turning 5 in 2022?
Thanks for that question, Craig. I anticipate at the moment, and certainly for the early starts of this campaign program, that you will have to have turned 5. So it'll be based on your birth date as opposed to the year you were born. So for example, if you were born late in 2017, you're still going to have to wait till your birth date, even once we enter 2022. So I think at this time, it is going to be based off of your birth date. You will have to have turned 5 in order to be eligible to receive the vaccine, not turning 5 in the year. That may change over time. The key thing is that as kids get younger, the difference between somebody who's just turned 4 and somebody who's just turned 5 or is about to turn 5 can actually be pretty substantial. And so we know that these studies were done exclusively on those 5 and older. And so I would imagine that certainly early on during the campaign, the focus will be adhering to that 5 and older protocol.
Thank you very much. And let's go to the next question from Sawyer Bogdan at Global News Radio 980 CFPL. And Sawyer asks, it's a question for Mayor Holder and Dr. Summers. Sawyer and everyone else, I do have to let you know that unfortunately Mayor Holder had to step away from the briefing. So we will turn this one over to Dr. Summers. Dr. Summers, can you provide any comments or guidance in regards to the safety of events like downtown London's festival or markets this holiday season?
Thanks for that question, Sawyer. When we're looking at the safety of events this holiday season, there's a few things that we will look at in terms of providing some degree of risk assessment. We look at the vaccination status of attendees. We look at whether it's indoors or outdoors, and we look at whether or not there's some physical distancing that can happen. The good news about these outdoor events is that the risk of transmission in an outdoor setting is substantially lower than an indoor setting. And when we look at the high vaccination coverage amongst a majority of people that will be attending those, we can be encouraged that in an outdoor setting with a highly vaccinated population, the risk can be reduced dramatically. There's no such thing as no risk and absolute risk here. It's all about a reduction in risk. And events like the London Festival or markets, that type of stuff this holiday season is reduced by being outdoors in substantial ways. And certainly knowing that a majority of our population, a super majority of our population, is vaccinated.
Let's go to a follow-up question from Sawyer Bogdan. Dr. Summers, the province announced last hour that Ontario students will be sent home for the winter break with 5 rapid antigen COVID tests each. What impact will this have locally?
Thanks for that question, Sawyer. Yeah, we're aware that the provincial government through the Ministry of Education has instituted that initiative for students in publicly funded schools after and heading into the holiday break. Hard to know exactly what impact that will have here locally. The use of those types of tests in asymptomatic individuals done kind of sporadically in that way, hard to know. What we can say is that if anybody tests positive, it's absolutely critical that they get a confirmatory test with a PCR test. And of course, if you have symptoms of COVID-19, isolate, get yourself tested using a PCR test at one of the assessment centers. That'll be the key.
Thank you very much, Dr. Summers. Let's go down to the next question. And the next question comes to us from Jane Sims at the London Free Press. Dr. Summers, the health unit has reported 3 deaths this week associated with COVID-19. Were these people fully vaccinated, partially vaccinated, or unvaccinated?
Thanks for that question, Jane. Yes, tragically, we have reported 3 deaths in the last week. Of those 3 deaths, 2 individuals were unvaccinated, 1 individual was partially vaccinated. None of those individuals were fully vaccinated. The data that we, and certainly our observations here locally and the data across the province is consistent. The risk of hospitalization, ICU admission, and death is dramatically reduced amongst those that are fully vaccinated. The estimated risks of ICU admission, it's about a 26 times higher risk of ending up in ICU if you end up with COVID-19 if you're unvaccinated relative to those that are fully vaccinated. It's a profound difference. Again, we are very sad about the announcement of those deaths over the last 3 weeks, and certainly a reminder of the importance of vaccination and the ongoing impact that this pandemic is continuing to have in our community.
Thank you, Dr. Summers. Next question is from Sawyer Bogdan. And it's been a while since you've had one of these, and Sawyer does say at the end of her question, sorry for all the questions. Dr. Summers, this is a 4-parter. Dr. Summers, what is the difference in the vaccines for children and those for adults? You mentioned a different bottle. Is that just for measurement, or are different ingredients involved? Next question, how soon will the new doses arrive? And also, how fast will you be able to get all children in that age group fully vaccinated?
Thanks, Sawyer. Let me see if I can get through those questions. They are good questions. In terms of the difference between the pediatric dose and the adult dose, certainly the concentration of antigen, which is the really critical part of the vaccine that induces the development of antibodies and immunities, that concentration is lower in the pediatric dose. We'll be hearing a little bit more from Health Canada about any of the other differences, and we'll be able to speak more comprehensively on that over the next little while. We're still waiting on that information, but we do know that the concentration is different. We also, it appears as though the pediatric vials are able to be stored in a fridge for longer than the adult version was. So it'll be a little bit easier to use, which is always a helpful thing. That's probably based off of how it's been studied by the Pfizer company in its development. But we'll be able to provide some more details there in a short little while. In terms of how soon will the doses arrive, pretty soon following Health Canada approval. Again, we don't quite yet know the turnaround time. Hopefully as soon as possible so that we can start to get doses into arms. I frankly don't think it's going to take more than a week, but again, we have to wait and see. We think that those doses are going to arrive very quickly once Health Canada approval has been given. In terms of the pace and time in which it's going to take for us to get all children in the age group fully vaccinated, Some of that depends on the demand, right? It depends on how quickly people bring their children 5 to 11 to get vaccinated. From a capacity perspective, our goal was to ensure that we could, in our region, vaccinate 100% of those 5 to 11 within 4 weeks of approval of the vaccine. We have that capacity in our region. We have the capacity to vaccinate 100% with one dose all children in our region through pharmacies, primary care, and mass vax within the first 4 weeks that things become eligible. Again, it doesn't mean that in 4 weeks we're going to have 100% of that population vaccinated, because we know that demand will play a role in that, but certainly the capacity in the region is ready.
Thank you for those responses. And just a quick point that I think you were mentioning demand for the vaccine in that 5 to 11 age group, Dr. Summers. It's interesting when we look at the vaccination coverage in London and Middlesex County, that one of the groups with the highest vaccination rates are the 12 to 17-year-olds, with almost 94% of them having had a first dose and just under 90% with both doses. So that is encouraging as we move forward into this next phase of the vaccine rollout. Dr. Summers, we've got another question from Sawyer Bogdan, Global News Radio. Dr. Summers, a lot of children have a fear of needles. What is being done to make the process less scary for them?
A great question, Sawyer. Over the last couple of months, we have been meeting with experts in pediatrics. We've had a pediatric vaccine task force that has been working with people from the Children's Hospital, primary care, experts from Middlesex-London Health Unit on giving vaccines to kids, gather together to figure out ways to make our mass vaccination clinics and all of our clinics as child and family friendly as possible. We're trying to give a little bit more time and space so that we can make that environment as comfortable as possible. When you arrive at the clinic, our vaccine superhero will be all over the place, and there'll be lots of distractions available for kids so that they can focus on some other things while they're preparing for their vaccine. We've got look and find tools in place. We've got stress stars in place. They're like those squeezy things that kids can hold on to in anticipation of their vaccine. For parents, in anticipation of coming to the clinic, make sure you talk to them about what's happening and thank them for doing their part to get vaccinated. These types of things make this a less scary experience. We've all gone through the experience of getting vaccinated, and at the end of the day, we know that it's the right thing to do, but we also know, even as adults, needles aren't so fun. So talking to kids about what to expect, the fact that it's actually going to be an okay experience and that they're doing something that's going to be good for them and good for the people around them. Lots of things can be done to make this experience less scary. Over the next little while, you'll see some additional resources roll out through the Middlesex-London Health Unit's website to talk exactly about how parents and guardians can prepare their kids for coming to our mass vaccination clinics. And when you arrive, I think you'll find the environment to be quite friendly for kids. Thanks for that question, Sawyer.
Thank you very much, Dr. Summers. You took the words out of my mouth. I was going to say, check the Health Unit website after those announcements are made by the federal and provincial governments for resources and tips to help children prepare for their vaccination. Dr. Summers, we've got a question from Craig Needles at Blackburn News. Dr. Summers, do you expect to still be in your current role in December and January when the vaccination booster demand increases?
Thanks for that question, Craig. I will continue to be in this role for as long as the board requires to be in this role, and certainly a privilege to be able to work with such wonderful people at the health unit and such wonderful people in the community to continue to do the awesome work that we get to do as a local public health unit. Thanks for that question.
And the last question in the queue this afternoon, as we've just passed 2:30, from Jane Sims, and it is related to the vaccination campaign for children. Jane asks, Dr. Summers, how many children will be eligible for the vaccine once it is approved?
Great question, Jane. Somewhere between 38 and 39,000 kids will be eligible for that vaccine, because that's the number of kids in that 5 to 11 age cohort. So yeah, somewhere between 38 and 39,000 kids will be eligible to receive the vaccine, effective the Health Canada announcement.
Thank you very much, Dr. Summers. And that does bring us to the end of our questions for this afternoon. Thank you for joining us, Dr. Summers, and Mayor Holder, for sharing your insights and information as we continue to engage and meet the challenges of the COVID-19 pandemic. That'll do it for today. We'll be back with our next virtual media briefing next Monday. That will be on the 23rd, if you can believe that. I think that's what it is. There's the 22nd. It's going to be in there on Monday afternoon at 2 p.m. It'll be the 22nd. There you go. I'm a words guy, not a numbers guy. Thank you for joining us once again. Between now and next Monday, have a great rest of your Thursday afternoon. Have a wonderful weekend, and so long for now.